Once again. Hello.
Hello, good morning.
Good morning. For those of us who are on, yes, good morning. The rest, I think they will be joining us. This is the first antenatal class that we are having in the year 2021. And my name is Mrs. Adesina, the matron of Mother and Child Hospital. So once again, good morning, everybody. This morning, the topic we are going to discuss on our antenatal class is about delivery. Delivery. Specifically, we are going to talk about CS, Caesarean Section. I hope we are all hearing me.
Yes.
All right.
Yes, ma'am. Yes, ma'am.
There are different types of delivery. You have spontaneous vaginal delivery that everybody calls normal delivery. And you also have Caesarean section, which is also a normal delivery, but has another way of the mother being delivered. And then we also have assisted delivery, where the mother is helped midway to completing the delivery. So we have spontaneous vaginal delivery, where the woman delivered by herself. We also have another spontaneous delivery but the woman is assisted either by using vacuum. At that point, the baby's head will already be at the perineum, but the mother, maybe for one reason or the other, is not able to push the baby out. So your midwife or your doctor will help to bring out the baby's head still through the vagina with the help of, or with the aid of a vacuum extractor. And then your doctor can also use what we call forceps. You can also use the forceps to help to deliver the baby's head if the baby's head is not close, to the perineum. But this morning, what we are going to discuss mainly is Caesarean section. Many people, many pregnant mothers, when they hear of Caesarean section, you will hear them saying, God forbid, nobody will deliver me by knife. But whether you deliver the baby yourself or you are helped to bring out the baby by your doctor, delivery is still delivery. What is important is that the mother is well and alive, the baby is well and alive. So, what do we mean by Caesarean section? Caesarean section is a surgical delivery wherein your doctor cut through your abdomen, through your uterus, and bring out the baby. There are so many reasons why Caesarean section can be carried out on a pregnant, termed woman. Let's look at indications for Caesarean section. Sometimes it could be as a result of the passage or the passenger. When I mean the passage, I mean the canal through which the baby is birthed. I'm talking about your cervix, I'm talking about your pelvis, I'm talking about the vagina. That is the passage through which the baby is birthed. If there is any issue with any of those areas, then the baby may not be able to come out, and then Caesarean section can be indicated. Or if your baby, that is the passenger, is bigger than the size of the passage, then your doctor will say, I will bring out this baby. It is safer for the woman to show understanding, because your doctor's desire is to see you happy with your baby at the end of a pregnancy. But when there is any issue concerning the passage of the passenger, then your doctor will offer you cesarean section so that you and your baby will be alive and well. Sometimes another indication for cesarean section could be a distress. Distress rather can happen to either the mother or the baby. Sometimes during labor, we hear some women saying that they are tired, they cannot go on. They can even be asking for cesarean section. When we notice that they are tired, then cesarean section can also be indicated. Or we notice that your baby, you will notice that during labor, the midwife will come and listen to your baby's heart. But during this time, if while listening to your baby's heart, we discover that the baby's heart is either going down below the normal, or going high up above the normal, then we say the baby is in distress. In fact, one way we can also know that the baby is in distress also is, during labor, we sometimes rupture your membrane and allow your water to flow out to improve your contraction. But when we break your water and we notice that the water is colored, the water normally should be clean, clear, without any smell. But when we rupture it and we notice that the color is greenish or frank green, it means your baby has poo-poo inside because the baby is tired. So at that point, your doctor will also ask you to undergo cesarean section. Sometimes, I hope we are listening to me.
Yes, ma'am.
Yes, ma'am. All right. Sometimes when you have scan during your antenatal, towards the end of the when you are almost term, and your doctor discovered that your baby is lying abnormally, we call it presentation. Normally, towards the end of end of the pregnancy, the baby's head should be down towards your vagina. The baby's head is what is expected to be inside your pelvis towards the vagina. But for one reason or the other, sometimes when scan is done, we discover that some babies can be lying across the woman's tummy, head on one side and the bum bum on the other side. Or the baby can lie oblique. The head might be facing the hip of the woman and the legs on the other side. And sometimes it could be breech. We all understand what breech is. Instead of the head being in the pelvis, it's the baby's bum bum that will be there. So when there is an abnormal presentation like that, your doctor will counsel you to have cesarean section so that there will not be distress or danger to either you or your baby. So in case of malpresentation like breech, oblique presentation, or transverse, then your doctor will ask you to have cesarean section. Another reason for cesarean section could be placenta position. Placenta position. Normally, the placenta can be positioned either at the fundus of your uterus, that is at the top, or by the sides of your uterus. But in any case where the placenta decides to position itself frankly on top of your cervix, then you know that normally it's the baby's head that should come out first before the placenta. But where placenta is coming first is an abnormal presentation. And in that case, your doctor will ask you to undergo cesarean section. Sometimes you can also have what is called post-datism. Some of our pregnant women, when the EDD is already on and they are not having any symptoms of labor, any signs of labor, when they are term, then the doctor can give such a woman extra 2 weeks. You know, the baby's delivery can either be 2 weeks before or 2 weeks after. But where the woman is getting to 40 weeks, then at that point, the placenta may not be able to carry or nurture the baby again. So the doctor can ask the woman to have cesarean section. Then there's another indication that can warrant cesarean section. This is called failed induction. Sometimes when your baby is post-date, the doctor can induce you. When the labor is not coming naturally by itself, your doctor can induce you. And when you are induced, some will go through the induction and baby will come. But some, despite the induction, they will not even contract. Some can contract and their cervix will open midway and then stop. So when this happens, your doctor can also ask you to undergo cesarean section. These are the indications that we have that can make your doctor to say that you should have cesarean section. The reason why we are going through this topic is because so that our pregnant women will be informed. Some women, because of lack of information and knowledge, they have, lost their babies and lost their lives. Because when they are supposed to have had cesarean section and be well and their baby, they've insisted on having spontaneous vaginal delivery, and a lot of problem would have happened, and then they would lose their life and lose their baby. So I want to believe that having had this information, we will be informed. And whenever your doctor says that is offering you cesarean section, you will know why you are being offered cesarean section. Hello?
Hi.
Yeah.
Hi.
Okay, let's move on to how do you prepare for cesarean section? How do we prepare for cesarean section? Let's assume your doctor has now informed you that, madam, this baby is big, you may not be able to deliver this baby yourself. So I want to bring out this baby for you through cesarean section. Now, the doctor has explained the reason why he's going to do cesarean section for you. You are informed. So the next thing we are going to is how we are going to prepare you for this cesarean section. Once your doctor has informed you about this, it will send you to the nurse. And the nurse will give you a paper. There's a paper we now give you now. It's called Preoperative Information paper. In this paper, there are informations that you will need to know so that when you come, you will understand every step that will be taken to prepare you for the surgery. Number one, you'll be told to sign on the day of surgery. That's what you will do. But as you prepare for it, number one, on the information book, you'll be told when to come into the hospital. You'll be told to come in a day before, not on the surgery day. You cannot come for surgery in the morning of the surgery day. It is not healthy. It is not good. So your doctor or the information book will tell you that you will come a day before. You can come around 6 p.m. And when you come at that 6 p.m., you will be told to go to the lab. The lab will take your blood specimen. They want to know your PCV. They want to know whether you have any infection. They want to know, the level of a lot of things in your body before you go through the surgery. Then, two, they will also want to do grouping and cross-matching for you in case you will need to be transfused. When a woman delivers, the uterus bleeds, even the woman bleeds. So if the bleeding is minimal, then you may not need to be transfused. But you can never tell which woman will bleed after delivery. So that's why we always want to make sure we have 2 pints of blood ready just in case. If you don't need it, we will not give it to you. If you need it, they will be giving the blood. Instead of us now waiting and asking the lab people to come and take your blood and start your screening and all the rest of it. All these things will be done a day before. Then you will be taken to the room and given a room. And in the room, you will be given a consent form to sign. Because your doctor has explained the reason for the surgery to you, you will just the signing of the consent form will not be difficult for you. Then you will be told not to drink water from 10 p.m. On the day, from 10 p.m., you will be told not to drink water or eat again, so that your stomach would have digested whatever food you have eaten earlier in the day and keep your stomach free, so that when you are lying down on the operating table, you will not, if you have to vomit, nothing will come out. Then you will also be informed about cleaning your fingernails. Some of our pregnant women, they are pregnant and they are sexy, pregnant and beautiful. If you see their nails, is beautiful. Yeah, their hair is beautifully made. But we'll say that if you have to come for cesarean section, we'll just encourage you to please remove all those artificial nails. They are fine though, you can put them back after the delivery. But before the surgery, we will encourage you to clean them before coming to the hospital. Clean them before coming, remove them and clean before coming to the hospital. When you come in for cesarean section, inside the theater, there is something they will put on your thumb to measure the oxygen that is inside your body. But if you have long fingernails or you have pains on your fingers, it will interfere with the oxygen saturation that we might want to read from you. So this is the reason why we say remove the artificial nails, remove the cortex that you have on your nails. And then you will also find out in the information paper that if you have artificial teeth, you should remove it so that we don't have issue with it in the theater. And then your hairstyle, when you are coming for surgery, you'll be told not to wear bogus hairstyles, because if you are lying down and the hair is bogus, it will it will not allow your head to rest properly on the pillow that we are going to give you. And if the anesthetist needs to do anything on your head, it will be difficult. So we prefer that your hair is made simple so that nothing will interfere with the anesthetist. And then we also encourage you that when you are coming for cesarean section, your husband can come with you, your sister can come with you, but not more than one person. Going to the hospital is not too safe these days because we want to keep ourselves safe. So when you are coming for cesarean section or any surgery, we encourage that either your spouse or somebody you trust that you want to stay with you, the person can come along with you. So after, then you also be told that if anybody has to visit you, the visiting time is also stipulated there between 4 p.m. and 6 p.m. After you might have been given that information paper before the surgery, on the morning of the surgery, of course, you will be in the hospital. The nurse will change your clothes into, there's something we call theater gown. It will give you, you will wear it. The doctor will come and set a line for you, for you to have a drip while you are in surgery. And then they will move you to the first um, the first room before you enter the you enter the theater. There they will also put a catheter for you. The catheter is a rubber that they put inside, that the nurse will put through your urethra into your bladder. This will help to drain the bladder, because during the surgery and after the surgery, you will not be able to get up to go and wee. So this will help to take care of the bladder. And then the anesthetist will come and talk to you and tell you, explain what is going to do for you. Usually what we do, there are two types of anesthesia that they will give you. Either you sleep, or they give you injection at your back, so that between your mid waist down is the only area where you will not feel pain. But from your waist up, you'll be able to communicate and you'll be able to move. But from your waist down, it will be numb, so that you don't feel any pain during the surgery. And as soon as your baby is out, you'll be the first person to see your baby. You'll be shown your baby. And after the cesarean section, which usually does not exceed maximum 1 hour, you'll be out of the theater and in the recovery room. In the recovery room, you'll be given injections to stop any pain. And the following day after the surgery, you'll be moved to the ward, and on the ward, your analgesic will also continue. Second day, third day, on the second day, when you start belching or passing gas from the anus, you'll be offered warm water. After warm water, you'll be given tea, black tea, and after that, you can start. Once your bowel function is restored, then you can start having your proper meal. And then on the third day, your third or fourth day, your wound will be opened, removed, the dressing will be changed. And on the fourth or fifth day, you may be asked to go home. So you can call, if the type of incision that you are given is the one that you will have to come and remove the stitches, your nurse will tell you. And if it's the one that you won't have to remove the stitches, they will also tell you. So that is all that you need to know about cesarean section. I want to listen to your questions. Hello? Is anybody hearing me?
Yes, we are here.
Yes,
Yeah.
ma.
Yeah. So I want to listen to any question. I know nobody wants to have cesarean section, so, but just in case, you need to understand and know what to expect. So that's why we are taking this topic. Annie, I can see you. Good morning.
Good morning.
Morning. I'm still waiting for questions.
I have a question, please.
You can ask any question. It may not be on this topic. You can ask it all the same.
Okay, my question is that
What's your name?
my name is Mrs. Ojo.
Okay, Mrs. Ojo.
Yes, ma. My question is it only patients who come for cesarean section that will be given a theater gown to wear? And does the hospital also perform skin to skin for mother and child?
Yes, we do skin to skin for mother and child. We do. Once your baby is delivered, you put your baby on your tummy. You feel your baby.
Okay.
Yes. When you are going for surgery, you wear theater gown. But when you are when you are in the labor room to have your baby by yourself, there is another gown, delivery gown that they will give you. So they are not.
Okay.
Yes.
Then for the cesarean section, since the mother can't eat until when the bowels are moving, how does she breastfeed the child?
Some women, even before the baby is born, they are already lactating. But
Okay.
just in case they are not lactating when the baby is born, from the third day, definitely something will start coming out. It may not be much, but it would have been established. It would have been coming out. But while we are waiting for that, we ask the mother to buy formula. The baby may just take
Okay.
that formula for just 1 day or two. And once the breast milk starts coming, we withdraw the formula.
Okay, thank you very much, ma'am.
Welcome. I'm still waiting for your questions.
Good morning, ma.
Good morning.
My name is Jumoke. I wanted to ask, what complications can arise during a CS?
Well, usually we don't ask for complication, but they do arise anyway. Like that, I was telling you that one of the preparations we do is to take your blood samples and do what we call grouping and cross-matching. Check your PCV and then make available 2 pints of blood at least. That because sometimes during cesarean section, some women they bleed, and once they bleed, we don't want a situation where we'll not be able to restore the blood loss. So we give blood transfusion during during the cesarean section. So that is one of the commonest complications that can arise. Okay, from Oyesore Idowu. She's saying, are we to shave before we come? Sorry, I didn't mention that. Yes, you can. Hello? Are we listening? Hello?
Yes.
Yes, ma'am.
Yes, ma'am.
That question. Yes. I forgot to mention that when you come in, if you have not shaved, the nurse will shave you. But there's nothing wrong if you shave before coming. Some prefer to use cream or shaving stick. You can shave before you come, or when you come to the hospital, the nurse will shave you. It's to remove skin from the area where the doctor is going to put the incision. Annie is saying, what should we expect for second time cesarean section? Yes, for second time cesarean section, there's not much. Nothing different from what you expect cesarean section. Nothing more. The incision is going to be on the same side.
The good thing about it is that everybody need break, right? I'll link up a new YouTube later.
Hello.
Actually, we go good to match.
Some people should mute themselves. They are disturbing us.
How are you?
Please, Mr. Bakare, can you mute? Thank you.
Yes, some people should mute. Yes. Okay, I've seen the question from Annie. Nothing different from what you will expect during the first cesarean section.
Okay, good morning, ma.
Yes, good morning.
Okay, for someone who has had like 3 myomectomies before, so this will be like the fourth time, like the fourth operation. Is there anything to hello?
Hello, I'm listening.
Okay, is there anything to look out for, or is there anything to prepare for? Like
Yes.
3 previous myomectomies.
Yes, for somebody who's had 3 previous myomectomies, that person should not look forward to spontaneous vaginal delivery. That person, definitely, the doctor will tell that person to have cesarean section.
Okay.
Yes.
Okay, thank you.
You're welcome. Hello? Any question more?
Yes, ma. Sorry, I have one more question.
Okay.
Please, is it possible for someone to do a test to know if you'll be able to do a normal delivery, or you have to opt for a cesarean section?
Yes, there is a test that your doctor, your obstetrician will do for you from 36, 37 weeks. Usually, the
Okay.
doctor will ask you to, during one of your antenatal, there is something they call pelvimetry. It will
Okay.
put hand and check whether the size of your baby's head will be able to pass through the pelvis. At that point, your doctor will tell you, he can say it's 50-50. When he says it's 50-50, it means the doctor will allow you to try. You may be able to push through, or if you cannot push through, then the doctor will tell you that if I wait for you for so hours and you are not able to push through, then I will bring out the baby. But if you are able to push through, it will tell you that, okay, baby will, of course, we will know in the labor ward, baby will come. But if your doctor tells you after performing pelvimetry for you and says the baby's head is bigger than the passage, then it means you will have to go through cesarean section. Sometimes it's like that. Then somebody is asking,
Okay.
yes, somebody is asking a question. If my wife refuses to have CS for religious reasons, can the husband legally ask for the CS? Well, this is between husband and wife. And that is why we are taking this topic during this antenatal class, so that our women will be informed. You see, it is disheartening to see a woman go through a period of pregnancy, and at the time when you are supposed to deliver and enjoy your baby and yourself, you will now lose the mother and lose the baby just because we are not informed. It is not a sin to have cesarean section. It is not a sin to have cesarean section. If the woman is informed, she will understand that our religion has nothing to do with this surgery. In the Bible, we have seen some women that have difficult delivery. Sometimes they lose the baby and lose their lives. Sometimes they have the baby. Rachel is one of them. She had difficult delivery. She had the baby, but she died afterwards. So our religion has nothing to do with whether we have cesarean section or not. And then if the wife assume or knows that the husband is the head, if the husband says, my dear, please, I will sign for this cesarean section. I want you and my baby to be well. It is godly. This is righteous and it's godly. I hope Benny Sokoso is hearing me. Hello?
Yes, thank you.
Yes, ma'am.
Okay, all right. I hope I've been able to answer that question well. Any more questions? You can write your question, I'll read it. Hello?
Hi.
You can mute yourself and ask your questions. Hello?
Hi.
Hello.
I don't think there are other questions.
Good
Hello?
afternoon, ma'am.
Okay. I think so.
Okay, so I just want to ask, is that I don't know if you've addressed it while I was not around.
Okay.
Is there a limited number of times CS can be done on a woman?
CS, you can have CS as many times as 4 times maximum. It's safer to have it the 4th time, maximum 4 times. But you can also ask your obstetrician, but know that maximum 4 times is okay. Then somebody is asking, when do one start feeling your baby move? From 20 weeks. Before 20 weeks, some can start feeling the baby move. So this brings us to the end of this antenatal class. I hope you are well informed by the topic. And thank you. See you again in another fortnight. Thank you and goodbye.
Thank you, ma'am.
Thank you,
Thank
ma'am.
you, ma'am. Thank you so much, ma.
Thank
Thank
you.
you. Thank you, ma.
Thank you, ma'am.
Thank you. Thank you, Dr. Bankole. You're welcome.
I'm sorry, I didn't know when I unmuted.
Yes, because you were talking behind the.
No, I just got Pastor Dan and the wife just came inside.
Okay.
So
Please
I have not
extend my
seen.
greetings to them. All right. Goodbye.
Bye.